Hello, everybody, and welcome to the Body Smart Ultimate Back Pain Guide. I am so excited to be with you here tonight to continue this epic week we've had of helping people identify what type of low back pain they have and eliminating it. So let's dive in and get started. I'm going to shrink myself here in the corner, and we'll get going. So let's talk about the three different types of low back pain. Just a quick recap. We had this conversation a couple of days ago, so if you have any questions about that, go back and listen so you can find out what type of back pain you might be experiencing. Tonight we're going to talk about number 2, disc problems. So problems with the discs of your spine. So who is this and who does this affect? This is typically those that are younger, 18 to 65 years old, people that are active because it's usually an active injury. Somebody moves wrong and injures that disc, or it's something from prolonged positioning, sitting, standing, especially standing on concrete. Those types of things, they tend to flare it up and cause this type of injury. When we notice it is anytime we're getting up in the morning, bending, lifting, twisting, those types of things, they tend to trigger our pain. This type of pain is usually characterized by radiating pain often as well, flank pain or anything down the leg or buttock. Those types of symptoms, and they are serious, and we want to get rid of them as quickly as possible so they don't cause additional pain problems and don't last for a long time. So this is something that normally lasts for weeks, but can sometimes last for months. And so we want to nip it in the bud. The sooner we get treatment, the faster we can get it resolved. And so we want to get in and get it resolved as quickly as possible. Otherwise, it's going to last for a much longer period of time. So let's get in and get it taken care of as quickly as possible. So what are some things that we can do? We're going to hit that hard. What are some things we shouldn't do? Muscle relaxers, painkillers. I would avoid those. They actually prolong the healing time, prolong recovery time, and make it a little bit harder to know what's going on in your back. You can't feel it as well. And so we do things that re-injure it and keep us in that pain cycle. So we've got to get rid of that. Don't necessarily need to go to the emergency department with that, and we'll talk about that a little bit later. This is something that requires treatment though, but I recommend more hands-on treatment and specific exercises that help us restore our function. So what is disc-related pain? So let's get down to the anatomy of it. So we've got our spine there. We've got the stacking of the bones in the spine with the jelly-filled center discs in the middle. So I like to equate those to a jelly-filled donut, the discs. And so what happens, the bones, we take those, and if we're sitting with poor posture here, the bones flex and squish that front side of the disc. And here's what happens if we do that. We get disc bulges. So if you look, the normal disc, you've got that tough outer layer. And so I relate that to a jelly donut. You've got that tough outer layer is like the bread of the donut, then the jelly-filled center. So you've got the annulus fibrosus and the nucleus pulposus. And when that nucleus pulposus starts to bulge out because we're squishing one side of that disc by leaning forward, it pushes that disc material out and against your nerves. And that causes a lot of pain. And so just depending on how severe that is, we can have anything from just a simple disc herniation, where it's just pressing out against it, all the way to a disc protrusion where that disc has ruptured that annular fibers. And here's just kind of a different view of it. Same idea, as those annular fibers break down from constant positioning or just one high force bend and twist and lifting something heavy, we can get tears of that. And then that disc material pushes out against the nerve, causes some mechanical breakdown and a lot of inflammation and irritation. So that's what happens. How do we make that get better? Well, our first 3 goals of treatment: decrease pain, restore normal motion and function, and eliminate the true cause of the pain. So let's dive into that. How do we decrease pain? Ice. We want to use ice and not heat, simply because it can break up that inflammatory cascade. It can slow that process down, so it stops new inflammation from entering the area. Ibuprofen, anti-inflammatories can be helpful as long as your stomach tolerates that and your doctor says it's okay. Not a bad option to help. Isn't going to heal anything. Massage or vibration, electrical stimulation and TENS, those types of things can help just kind of break up that cycle. Honestly, this is something that you need help to resolve. I would go see a physical therapist right away. And I'd see a PT over other practitioners simply because we can decide really well whether or not we can get the treatment started there safely and healthily, or if you do need to go get an MRI or see a physician to make sure that everything's safe and okay. Physical therapist has actually been shown to be the most accurate at determining what the best course of treatment is, as well as it saves a ton of money because we can skip the MRI, we can skip your family practice doc copay, plus going into a specialist, plus the MRI copay, all of those different things. We can just go right to the source because more often than not, your neurologist or back pain doc will tell you, you know what, let's try physical therapy before we try anything else. And so you just kind of skip that step, saves a lot of money. And if you're worried about whether or not to get a physician referral, most insurances will allow you to at least have that initial screening visit done without the physician referral, as long as you get one soon. In the state of Utah, you actually don't need a physician referral to be seen by a physical therapist, and you don't really need one for most insurances anymore. There are still a few, but like I said, most of them allow you to start the treatment and then get that referral, and you're okay. Check with your plan if you've got questions. Honestly, here at Body Smart Physical Therapy, we do insurance backwards. So we get started right away, get you pain-free as quickly as possible, and then we submit it to insurance later. People wind up saving money because we can typically see you less often, fewer visits, because we see you one patient at a time for the whole hour. So it winds up saving money, kind of doing insurance backwards. And most of the time, it works out great. People save money, and a part of that is reimbursed still through insurance about the same rate as what your copay and co-insurance would have been anyway. And so that typically helps. Some other things that you can do to help, spinal decompression or traction in clinic can help with some people, not everybody, where we just unload the spine. Epidural injections can sometimes help, and so we can help you determine whether or not you need that. And then my favorite way for managing pain is with directional preference or directional movement in specific directions. And so let's dive into what those are. These are my three favorite go-tos for this type of pain, for disc-related problems. The first one, you want to just lay on your elbows and let everything relax. This is kind of when the pain is really severe, biting, catching, and you can't straighten up, and it feels like somebody's stabbing you. Do this one first and allow it to help you relax. As you progress, as things relax, start going into that kind of push-up and letting your hips stay down on the ground and doing kind of that yoga pose, bringing your shoulders up, pressing up, and just keep it really gentle. Move only into the pain-free range and then come back down. Just go right to the edge of pain and back down and work that. Do about 10 to 20 repetitions and then rest, and do that repeatedly throughout the day. The third one is usually for when people are getting better, but sometimes that's kind of the people's first go-to. Hands on your hips or over a countertop, bending over backwards. What we're essentially trying to do is, if we're squishing the front side of that disc and protruding or bulging that jelly-filled material out the back, we want to go the opposite direction. Everything we do in our day is hunching forward, so we want to go back the opposite way and massage everything back into the center with one of these three techniques. I would do them 6 to 8 times a day, especially before any activity that you know might flare it up. You want to do it before and then after again, so that you can resolve those symptoms and keep that disc centered and avoid the pain. Sometimes when we've got the pain on the side, just extending down one side, sometimes a side glide maneuver will help as well. I usually do this a little bit differently in the clinic than what's pictured here, but that can really be helpful as well if you've got the symptoms on just one side. Thanks HEP2Go for the awesome pictures. The second key then is restoring normal function. So what do? We want to keep moving so that we can maintain our mobility and avoid it getting really tight. So whenever we have pain, it tends to tighten up. And so we want to keep moving to avoid that tightness. Keep exercising, just modify. Only do what you can do without the pain increasing. And so keep exercising. If something hurts, just switch to something else. Do lower body or do elliptical instead of treadmill, or bike instead. Whatever you can do to keep moving and keep exercising and maintain your fitness. Maintaining proper posture is huge. Whenever we stack our bones the way they're supposed to be stacked by maintaining a solid core and proper posture, the pressure through the disc is even and we don't have problems. But if we get out of a good posture and we hunch forward, all of a sudden we're bulging that disc back out. Our body tends to find that weak link, right? And so it'll put that pressure through that disc and help it bulge out, and we don't want that. So that requires some hands-on treatment often to make sure that every spinal segment is moving properly so that it can work together as a unit. And so we can do some stuff to help relax the soft tissues around the spine and make sure that the spine is working in a unified way to make sure that the function is normal and that your pain is as little as possible. The other thing that we want to do is get down to the root cause. The root cause is usually prolonged positioning or an injury, and they're usually caused by weak core muscles. So we want to stay active. We want to keep moving. The more we move, the less we stay in a prolonged position for a long period of time. So take frequent rest breaks, get up and move, but also strengthen those core muscles so that we can maintain a neutral spine through all of that movement. Avoid prolonged positioning. Anything that just keeps you sitting, bad. Take frequent rest breaks. Get up and move every hour at least. Another key that's near and dear to my heart is decreasing your body weight. The increased body weight puts a lot more stress and pressure through each of the discs, and so if we can decrease the body weight, it also decreases that stress and pressure on the discs and makes it a lot healthier. The other thing is lift with your butt. Everybody says lift with your knees, which is partially true, but the thing is you can lift with your knees but still be rounded through your shoulders and back, and that's still going to put pressure through your spine. So what you want to do is keep your back straight and the relationship between your spine and your hips in a neutral position, and you want to bend at the hips, and so that the hips become the fulcrum point, and you're using your glutes and your hamstrings to control your body position. And so that is going to help you to keep a neutral spine and avoid pain and problems. So lift with your butt, not just with your knees. All right, so there is kind of the three main ways that we can get rid of that low back pain. Here's my big tips to avoiding pain in general. And that's just avoid pain, right? I know that seems a little naive, maybe a little counterintuitive, or maybe too obvious, but here's the deal. We have to avoid pain, and that helps us stay out of these pain cycles. So we want to be careful with high-risk activities that are high risk for pain, or the prolonged positioning, all those things that we've talked about. We've got to stay away from that kind of stuff that puts us at an increased risk. Anything with combined bending, lifting, twisting, especially with load. The other thing is being in pain causes more pain. The longer we stay in pain, the more that pain cycle perpetuates and the harder it's going to be to get out of pain. So the quicker you get care, or the quicker you interrupt that pain cycle with the ice, ibuprofen, all those things, the better off you're going to be. Don't wait for it to get better, or don't wait and see if it's going to get better. Get help right away and it'll resolve within days to weeks instead of weeks to months. We typically can resolve this, the painful phase of it, within a couple of visits, sometimes a couple of weeks, and then it still takes 6 to 8 weeks for your back to heal from it, but we can be pain-free while we're healing. The other thing is no good versus bad pain. And that sounds a little crazy. Bad pain is anything where the pain is getting worse. Good pain means, hey, it hurts because we injured it, but it's not getting any worse. And so I can keep moving and I can keep being active. If my pain is a 3 out of 10, and I can hop on an elliptical or a bike and my pain stays at a 3 out of 10, totally okay with that. If it starts to creep up 4, 5, 6, stop, modify that activity, or do something else that doesn't cause pain, and keep that pain around that 3 level. And hopefully we can do stuff that brings that continually down so that it's not hurting anymore. All right, so there it is. Those are my top tips. We are so excited to continue this week of relief, right? We have given you tips for the muscle strain or joint sprain type pain. Tonight we did disc pain. Tomorrow night we're going to bring age-related degenerative change. We're going to talk about how we can resolve those pain, or those symptoms and that pain. And then Monday, we're going to do a full recap of everything. We're going to bundle up everything we've talked about this week, and package it and deliver it to you so that you can have all of that at your fingertips so you can resolve whatever type of pain you're experiencing. Excited to be able to do that. So that's coming up on Monday. Hopefully all of this makes sense, that these are tips that you can use to help start resolving your pain now. If so, if it made sense to you, go ahead and comment below. Makes sense, I got it, thank you so much. If it didn't make sense, or if you still have questions, just comment below, I've got questions. If you do so, I'll direct message you, and we can start a conversation kind of on the side in private. Or if you just have general questions, feel free to drop those below as well. Happy to answer any of those. As always, you can contact us with any questions you might have. And I just want to thank you. Thanks so much for investing your time with us tonight and for following us this week. Hopefully we're helping you find ways to eliminate your pain. These really are some of our best tips. This is what I call back pain day 1 in my clinic, of just informing people what's going on with their back and how they can start relieving the pain today. And then back pain day 2, we start doing a little bit more rubber meets the road in terms of making it stay away. So excited that you could join us, and we'll see you tomorrow with our age-related degenerative type pain.